Hi, my name is Melinda. I'm doing the PNE head and toe assessment. I'm going to do a 360. Okay, and how you spell my name is Melinda Edowen.
Come in.
Okay, so I'm going to practice hand hygiene for 15 seconds. I'm going to put on my gloves. Put on my gloves and I'm going to disinfect my stethoscope. Okay. So hi, my name is Melinda. I'm going to be your student nurse today. We're going to do a head-to-toe assessment. Is that okay?
Yep, that's okay.
All right, so I'm going to provide my patient privacy, close the curtain. May I please have your wrist? Can you please tell me your name and your date of birth?
William Overton, May 31st, 1930.
Okay, so my patient was able to confirm themselves. I am now going to start with assessing my patient. I noticed that the patient's skin matches their ethnicity. My patient looks their age. There is no odor. My patient has good hygiene. They are dressed for the weather and their clothes are clean. I am now going to ask my patient 3 questions. Do you know your name?
William Overton.
Do you know where we are?
The hospital.
And do you know what month we're in?
April.
Okay, so my patient is oriented ×3. I'm now going to start with the head to toe assessment. I'm going to start at the head. I am now assessing the patient, inspecting the patient's head. The skin matches the patient's ethnicity. The color matches the patient's ethnicity. There are no lumps, bumps, or lesions, and no involuntary movements. I'm now going to test for cranial nerve 7. I'm going to ask the patient to smile. Smile with teeth. Puff up your cheeks. Frown. And raise your eyebrows. Okay, so now I'm going to ask the patient to close their eyes tightly, and I'm going to try to open their eyes with my thumbs with resistance. Okay, so the patient was not able to open their eyes as I was pulling it up with resistance, therefore cranial nerve 7 is intact. So now I'm going to assess the ears. The ears are symmetrical in size, the color matches their ethnicity, there are no lumps, bumps, or lesions, and I am not noticing any discharge coming out of the patient's ears or any swelling / edema. I am now going to assess the eyes. The patient's eyes are round. The sclera is pearly white. The lashes cover the upper and lower lid. Can you please close your eyes? There is no lesions on the eyelids. The upper lid covers the superior part of the eye down to the lower lid. I am now going to assess the sclera once more. There are blood vessels showing on the sclera, which are normal findings. I am now going to check the conjunctiva. So I'm going to move the patient's lower lids down. So the conjunctiva is reddish pink with signs of blood vessels, which are normal. There's no signs of ptosis or edema on the eyes as well. I'm now going to assess for cranial nerve 3. So I am going to take my pen light and I am going to measure the pupils. The pupils are 4 millimeters in size. I am now going to do the direct consensual light reflex. So I'm going to start with, can you look up to the clock, please? And I'm going to start with the left eye, so direct, consensual, direct, consensual. So my patient's eyes constricted as the light was shown onto their eyes, and it was direct and consensual, and they dilated when the light was removed as well. I am now going to test for accommodation. I'm going to ask the patient to stare across to the clock. I am going to ask the patient to stare at the top of my pen light, and I am going to move the pen closer to the patient, and I'm going to ask them to follow it. So just look at the pen light, and I'm just going to follow it to your nose. So my patient's eyes converged and constricted as it was getting closer to the patient's nose. Therefore, cranial nerve 3 is intact. I'm now going to inspect the nose. The nose is midline of the face. The color matches the patient's ethnicity. There are no lumps, bumps, or lesions. There is no crusting, there is no flaring, and there is no discharge coming from the patient's nose. I am now going to assess the patient's mouth. The patient's mouth is pink, which is normal. It is hydrated. There are no lumps, bumps, or lesions. I am now going to go down to the neck. I am going to inspect the neck. I'm actually going to go back to the mouth, and then I am going to test for cranial nerve 9 and 10. So first I'm going to ask the patient to open their mouth as I look in and say, okay. So the uvula was able to vibrate, and the upper palate was able to rise as the patient said, I am now going to ask the patient to stick out their tongue. And then I am going to ask them to move their left and right. And then I'm going to ask the patient to say light, tight, dynamite.
Light, tight, dynamite.
Okay, so the patient's tongue was midline. They were able to move it left and right. And my patient was able to say light, tight, dynamite. Therefore, cranial 9, 10, and 12 are intact. Now I'm going to go to the neck. I'm going to inspect the neck. The neck is midline. There are no lumps, bumps, and lesions, and the color of the neck matches the patient's ethnicity, and I'm not noticing any swelling / edema of the patient's neck. Can you please raise your neck up? The trachea is midline, and it doesn't deviate left or right, therefore there is no masses causing any deviation for the trachea. I am now going to palpate the patient's neck for any pain or tenderness. Is there any pain?
No.
Any tenderness?
No.
Okay. So I did not, the patient stated that there is no pain or tenderness on their neck. I am now going to palpate for the carotid artery, and I'm going to calculate the heart rate in 15 seconds on both sides. Alright, so the patient's heart rate is 70 beats per minute. It is 2+ normal, regular heart rate with, and is equal. I am now going to assess for cranial nerve 11. So I'm going to ask the patient to move their head left and right. And would you be able to shrug your shoulders? All right, and I'm going to do the same thing for the patient with resistance. So left, right, and shrug your shoulders. All right, so my patient was still capable of moving their head left and right and shrugging their shoulders with resistance. Therefore, cranial nerve 11 is intact. So now I'm going to go down to the upper extremities. The color of the upper extremities matches the patient's ethnicity. There are no lumps, bumps, or lesions. Hair distribution is divided equally along the upper extremities. I am now going to oh, and there is signs of muscle atrophy due to aging, which are normal findings. I am now going to palpate the patient's upper extremities for pain and tenderness. Any pain?
No.
Any tenderness?
No.
Okay. I'm also going to palpate for temperature. So the patient's temperature of the upper extremities is normal warm. I am now going to calculate the patient's radial pulse, and I'm going to do that for 15 seconds. Okay, so the patient's pulse rate is 70 beats per minute. 2+ normal, regular, and they're equal on both wrists. I am now going to do the grip test for the upper extremities. So I'm going to stick out my fingers and I'll ask my patient to squeeze on my fingers. So squeeze on my fingers, please. All right, so for the grip test, it was equal in strength. So therefore that is intact. I am now going to assess the lower extremities. So as stated, the patient had a fall, therefore there is bruising on the side of the patient's leg, which is 5 inches. So I will keep that intact. I will keep that in mind when I am palpating the patient's leg. So I am going to inspect. The legs are equal in, matches the patient's ethnicity. The hair is distributed evenly. There are signs of atrophy due to aging, which is normal. I am going to palpate the patient's legs, and I'm going to keep in mind again for the bruise that the patient has. Any pain, any tenderness?
No.
Okay. Any pain, any tenderness? Does the pain deviate to any part of the body?
It just on
Just
the bruise.
there?
Yeah.
Right, I'm also going to palpate for temperature. So the patient's temperature is normal warm. So, yeah. So now I'm going to assess the patient's posterior thorax. So I am going to ask the patient to turn around. I am going to cover the patient, lower extremities, like this, but then, sorry, yeah. Now I'm going to cover the patient's lower extremities, and I'm going to expose the patient's back. I'm going to inspect the patient's back. The color of the patient's posterior thorax matches their ethnicity. There are no lumps, bumps, or lesions. I am noticing that the posterior thorax wall is equal and symmetrical in size, and I'm not noticing any abnormal pulsations. I am now going to palpate for tenderness and pain. So I'm going to palpate. Let me know if you feel any pain. No. Any tenderness?
No pain or tenderness.
Okay, so the patient said that there's no pain or tenderness as I palpate the patient's posterior thorax. I am now going to palpate for temperature. The patient's temperature is normal warm. So now I'm going to auscultate for lung sounds. So I'm going to take my stethoscope. Okay. And I'm gonna start here. So every time that I place the stethoscope on your back, I would want you to breathe in with your nose and exhale through your mouth, okay?
Yeah.
Okay, so as I auscultated the patient's lungs, I did not hear any fluid in the patient's lungs. I did not hear any crackles or wheezing. I did hear bronchovestibular and vestibular sounds, which are normal findings. And as I was auscultating the patient's lungs, I did notice that the breath sounds were equal for both lungs, which are all normal findings. So I'm gonna now ask the patient to turn around as I face them anteriorly. And I am going to assess their anterior thorax. So as I am inspecting the anterior thorax, I notice that the patient's color matches their ethnicity. There are no lumps, bumps, or lesions. There's no edema. There is no swelling. There is no abnormal pulsations coming from the anterior thorax. And now I'm going to assess I'm gonna now auscultate the apical pulse rate. So I'm gonna start at the midclavicular line, and I'm gonna go down all the way to the fifth intercostal space. And I'm going to calculate the apical pulse rate for 30 seconds and times it by 2. Okay, so the patient's heart rate is 70 beats per minute. It is 2+ normal regular. I did not hear any murmurs. I did not hear any diastolic fillings. I did not hear S3 and S4 sounds, which are all normal findings. I did hear S1 and S2, which are also normal findings. I am now going to calculate the patient's rest rates, and I'm going to do that for 15 seconds. Okay, so the patient's rests are 16 breaths per minute, and the chest moved equally and without any distress or any struggle. So I'm now going to ask the patient to lie down on the bed. I think like yeah. I am now going to cover the patient with a blanket so that I will cover the lower extremities, therefore ensuring utmost privacy. Okay. I am now going to raise the patient's gown, and I am now going to inspect the abdomen. So the abdomen, the contour is flat. There are no lumps, bumps, or lesions. The hair is distributed evenly on the abdomen. I am noticing that the umbilicus is midline to the patient's abdomen, which are all normal findings. I am going to now auscultate the patient's abdomen before palpating so that I do not create any abnormal peristalsis when I auscultate. So I'm going to now use my stethoscope. I am now going to auscultate the patient's abdomen, and I am going to start at the right lower quadrant, and I'm going to work my way clockwise. So starting at the right lower quadrant, right upper quadrant, the left upper quadrant, and the left lower quadrant. Okay, I have finished auscultating the patient's abdomen. I did hear high-pitched bulborhagmus sounds, which are normal. I did not hear any vascular sounds as I was auscultating. I am now going to perform light palpation on the patient's abdomen, and I'm going to start at the right lower quadrant as I did as I was auscultating, and again work my way clockwise. So starting at the right lower quadrant, the right upper quadrant, the left upper quadrant, the left lower quadrant. Okay, so as I palpated the patient's abdomen, I did not feel any superficial masses as I was palpating, which are normal findings. So now I'm going to ask my patient to sit up. Okay. I am going to cover my patient, remove the blanket. I am going to set the bed to the lowest setting. I'm going to tell my patient that we were done our assessment. I'm going to ask my patient if they have any questions or if they're still experiencing any pain that was not discussed. Are you feeling any more pain?
No.
Do you have any questions for me?
No, I'm
Alright,
okay.
so the physician is going to be with you very soon, and that was the end of my head to toe assessment. So now I'm going to remove my gloves. Put them in the garbage, and I'm going to perform hand hygiene, and I will step out of the patient's room and fill in their chart, and that's the end of my assessment.